And when we think about the adverse effects of increased sugars, we're not just thinking about the calories. I think this is a major stumbling block I have when I talk to families, is that most families, most parents are mainly just concerned about the calories that sugar might be bringing into the body. But really we have to think about factors beyond the calories, and we're learning a lot about the way these different sugars are metabolized. So on the one hand, we have these glucose-based sweeteners like corn syrup, organic brown rice syrup, like I mentioned, and corn syrup solids, which I'll talk about, which is very common in infant formula in the U.S., even though I believe it's not allowed in the EU, but it's very common in the U.S. When you have a glucose-based sweetener, you're faced with the high glycemic effects, rapid glucose spikes, rapid insulin spikes, hyperglycemia, all those factors which may over time contribute to things like diabetes risk. And then on the other side, you have fructose-based sweeteners like high fructose corn syrup is the most notorious of all high fructose sweeteners. But newer ones sound a lot better, like fruit juice concentrates, agave, and even apple juice itself, which can have even more fructose than high fructose corn syrup. But yet, again, they sound quite healthy. So here we're dealing with the impact of fructose metabolism, and I'm going to show you very specifically how fructose metabolism differs from glucose metabolism in a minute. Fructose is not directly used for energy. It does not invoke an insulin response like glucose, and it is mostly converted to fat in the liver, contributing to fatty liver disease, and in that process also produces lipids and cardiovascular risk and inflammatory factors as well. So here is the only biochemical slide I have for you, which shows you the differential metabolic fates of fructose and glucose. So if you're drinking, for example, a soda or consuming sugar in its ordinary form, which is fructose connected to glucose, those are broken apart in the mouth and the gut. Glucose is absorbed and is, of course, used for energy throughout the body, whereas fructose goes its own way, and 90 to 95% of fructose is cleared by the liver under most conditions, where it's converted to triglycerides, which can build up as liver fat, which is a major new problem that we didn't see 10 years ago, or it's exported back into the circulation as VLDL and triglycerides, and that's where you get the link between sugar consumption and cardiovascular risk. Now, if you drink apple juice, stop doing that, please. If you drink apple juice has twice as much fructose as glucose. And we've done those studies. We've bought apple juice in the supermarket and we've sent it off to be analyzed, and apple juice is about 70 to 75% fructose. So now you've got much more fructose that gets fed to the liver and potentially converted to fat or to lipids into the circulation. And that's why we have a problem with apple juice. And so now you're probably thinking, well, if you're saying that apple juice is not good, does that mean I shouldn't eat an apple? And the answer is definitely that you should definitely eat an apple and not drink the apple, because an apple has a lot less fructose than a glass of apple juice. You might need 3 apples to make a glass of apple juice, for example. And it's much less fructose than a glass of apple juice, and you still have all the fiber and all the other micronutrients. But metabolically, the key difference that you might not appreciate is that fructose is slowly released. Because of the fiber and the digestion that's required, it's slowly released. And why is that important? It's important because recent studies have shown that under those conditions, the gut can actually convert some of that fructose into glucose. That doesn't happen when you get a massive infusion or influx of fructose like you would get from drinking it. So this is where metabolism matters, and you can get the benefits of the apple without the dangers of the excess fructose hitting the liver. But it's not just high fructose corn syrup that's high in fructose. In fact, there are many other popular nutrition Why is it doing that? Sorry, I'm not going to touch you. For example, high fructose corn syrup, the most common form is 55% fructose. But we showed actually that most sodas made with high fructose corn syrup has even more fructose. Apple juice, like I mentioned, is 70%. Some fruit juice concentrates are higher. And agave syrup can be 90% fructose. So over 10 years ago, we published this study, which was one of the first studies to show the impact of high sugary beverage consumption on obesity risk at a young age. This was a group of children, toddlers, aged 2 to 4 years of age. And basically we set out, when I started off on this journey, we weren't actually looking at the effects of sugar. We wanted to know in these kids, what were the dietary factors in early life that were contributing to risk for obesity? And what we found clearly was that the biggest factor was higher consumption of sugary beverages. And you can see the data here when we separated them into 3 different groups of non-consumers of sugary beverages, 1 serving per day or 2 servings per day. There's a much higher effect of much higher risk on obesity with the higher consumers. Now, I'll come back to this later, but keep this at the back of your mind, that this part of the study was just looking at kids who were not breastfed or were breastfed for less than 12 months. Hold on to that thought, we're going to come back to it. Now, moving on to the brain, I was struck by this study, which came out in 2017. This is in adults, using brain scans in the Framingham population-based study. So it's a large population-based study that found that adults who consumed sugary beverages over the long term ended up having a smaller brain, which is quite alarming. It's not, it wasn't a huge effect, but it was about a 1% reduction in brain volume. And there's also studies to show, not necessarily on brain volume, but at a younger age, we do see effects on academic performance. So this is a study out of Australia in a fairly large group of children who were separated into 4 groups based on the amount of sugary beverages that they were consuming. And these effects were controlled for other confounding family-related factors. But what they saw was a significant impact of higher consumption of sugary beverages on different test scores for grammar, reading, writing, and numeracy. And as you can see, in all cases, there's a significant impact on the test score with high consumption of sugary beverages. A colleague of mine at USC, Scott Konowski, has done extensive research on this from a mechanistic level in a rat model. It's very hard to understand exactly how sugar is affecting the developing brain. We are doing some newer studies using MRI, but in his studies he's able to dissect out the brain and look at specific anatomical effects. And this is, I think, a very important finding that gets back to this developmental issue that I mentioned earlier. So he took rats and he fed them an extra bottle of water or an extra bottle of sucrose or an extra bottle of high fructose corn syrup, and he measured how well they performed in a memory test. And a lower score means compromised memory performance. And what he found was a significant impact of sucrose and high fructose corn syrup on compromised memory performance. But what's critical in this study is he did that in rats who were adolescent. And yes, rats do have adolescence. It only lasts a couple of weeks. But in adults, he found no such effect. So it was just in the adolescent rat when the brain, and in rats in particular during adolescence, is a critical period for rat brain development. And then he did this remarkable study where he did the same study. He gave rats during adolescence from day 26 to day 56. That's 30 days of adolescence. He gave them the sugar, and then at the end of adolescence, they took away the extra bottle of sugar, for 4 months, and then he tested the rats again as adults and found the same effect on impaired memory performance, even though they had been off of sugar for 4 months, suggesting that there was a programmed effect of sugars that was irreversible. This is just some data again from adults now. We're moving to population-based studies, just showing one of the clearest examples, I think, is the link between sugars and cardiovascular disease. Now, we might not necessarily, thankfully, see cardiovascular disease in most children, but this study actually looked at the outcome of death from heart disease in adults over an extended period of time. And what they found, and it's a very large study, separating the adults into quintiles, you can see the highest quintile had almost a 2-fold higher risk of dying from heart disease than the lowest quintile of added sugar intake. Non-alcoholic fatty liver disease is a relatively new disease. It's now the most common form of liver disease, and it has displaced alcohol-induced liver disease as the most common form of liver disease. And the non-alcoholic fatty liver disease, which probably needs to be renamed, it's non-alcoholic because of the effects of carbohydrates and sugars on the liver. The reason that alcohol contributes to liver disease is that alcohol is taken up almost exclusively by the liver and is converted to fat. And I just showed you exactly the same pathway for fructose. So it's this exact same metabolic pathway for fructose in the liver as it is for alcohol. And you can see here, these are MRI scans across the abdomen. We're looking at a cross-section of the abdomen. Here's the kidneys, here's the spine. The red circles are the adipose tissue. And you can see 2 different teenagers, both have the same BMI. And a couple of things you can notice is that the distribution of fat is very different. This particular individual on your right has, has low amounts of subcutaneous adipose tissue and a lot of red inside the abdominal cavity. That's visceral fat, this stuff here. But the main point of this slide is also to show you the liver. This is the liver organ here. And even though this particular individual has a lot of visceral fat, their liver is relatively protected. In fact, it's a very healthy organ, whereas this liver, you can see it's brighter, and the brightness on this MRI indicates more fat, and it's enlarged. And this particular individual on your left has fatty liver disease, teenager, 12-year-old girl. This is a nice review if you're interested in this topic, published in 2021, that just reviewed some of the advances of the epidemiology of non-alcoholic fatty liver disease from 2015 to 2020, just showing you here some key numbers in terms of its prevalence, novel risk factors, rapid increase in incidence, and typical comorbid conditions that it's associated with. And from a dietary perspective, one thing is quite clear is you can treat this condition with fructose elimination. This is a study in children with obesity who were put on a fructose-free diet, 41 children. Difficult study to do because they gave them all the food to eat, so they knew exactly what they did and did not eat. And another striking thing is they did this for just 9 days, and after 9 days of fructose elimination, liver fat was significantly improved. The way they did this is not something you'd probably want to recommend as a dietitian, and there's a lot of dietitians in the audience. How do you get rid of fructose and keep everything else the same? Is you replace sugar with starch. Because if you do that, you keep the calories the same, but you eliminate all the fructose. It's not necessarily a recommendation, but it's an experimental way to remove all the fructose. And when they did that, they got fructose down to just 4% of the calories, and they got a significant improvement in liver fat from 7% of the liver to 4%. The clinical cut point for fatty liver disease is 5%. And remarkably, they saw this even in subjects who did not lose weight after 9 days. So the question is, that's a remarkable cure. How can we actually implement that? So we spent almost probably over 10 years, including getting the funding and doing the study and dealing with COVID. We just published this study last year where we said, okay, all we have to do is tell kids with fatty liver to not eat as much sugar and their fatty liver should resolve, right? Magic. Doesn't work. The clinical implementation is very difficult, as we know. So we did the randomized clinical trial in 100 Latino youth with obesity and high liver fat, randomized them to diet versus sugar restriction. They met with a dietitian monthly. We delivered them bottled water. We were able to decrease free sugar intake in the treatment group from 11.5% of calories to 7.3% of calories. We also get a small reduction in the control, but this reduction in sugars that we got was not significant enough to have an impact on liver fat or anthropometric outcomes. So just trying to implement this in a clinical setting is extremely challenging.